There is a therapy that can heal trauma without you having to talk about it in detail. It sounds almost too strange to be real, but it's one of the most evidence-backed trauma therapies in the world. It's called EMDR, and today I'm going to explain exactly how it works and why it works. When years of talk therapy haven't. Hi, I'm John Hawkins Jr. I'm a licensed psychotherapist and co-founder of Hawkins Counseling Center in Boynton Beach, Florida. I'm trained in EMDR and I use it in my practice. Let me show you what it actually is. EMDR stands for Eye Movement Desensitization Reprocessing. It was developed in the late 1980s by Dr. Francine Shapiro. It's now endorsed by the World Health Organization, the American Psychological Association, and the Department of Veteran Affairs as a first-line treatment for trauma and PTSD. Here's the core idea. When you experience a traumatic event, the memory doesn't always get stored correctly. It gets frozen, stuck, without being fully processed by the brain. And so it keeps showing up as flashbacks, triggers, nightmares, or a constant state of threat, even when you're safe. EMDR helps your brain finally process what got stuck. So why the eye movements? This is the part that people find the strangest. And it's also the part that neuroscience has the best explanation for. During REM sleep, the stage where your eyes move rapidly behind closed eyelids, your brain is processing the experiences of the day. It sorts memories, makes sense of them, files them away. EMDR mimics that process while you're awake. The bilateral stimulation, movements or sometimes tappings or sounds, activates both sides of the brain simultaneously. This allows the traumatic memory to be reprocessed and stored correctly, so it stops hijacking your present. The memory doesn't disappear, but the emotional charge attached to it significantly decreases or resolves. Here's what EMDR actually looks like in a session. Phase 1, preparation. Before any processing happens, your therapist spends time building safety, understanding your history, teaching you stabilization techniques, making sure you have the resources to handle what comes up. No good EMDR therapist rushes this. Phase 2, processing. You bring to mind a specific memory, the image, the negative belief about yourself, the emotion, the physical sensation. Your therapist guides your eye movements in sets, usually 20 to 30 seconds. Then you pause and report whatever came up. You don't have to describe the traumatic event in detail. You just notice what arises and follow where it goes. Over the sets, the emotional charge of the memory begins to decrease. What was overwhelming becomes more distant, more manageable, less like a threat. The research on EMDR is substantial. Multiple randomized controlled trials show that EMDR produces significant reduction in PTSD symptoms, often in far fewer sessions than traditional talk therapy. In 2013, a World Health Organization report stated that trauma-focused cognitive behavioral therapy and EMDR are actually only two psychotherapies recommended for children, adolescents, and adults with PTSD. It's shown to be effective for PTSD, complex trauma, childhood abuse and neglect, single incident traumas, accidents, assaults, disasters, grief and complicated loss, as well as phobias and anxiety disorders. This isn't alternative therapies, this is evidence-based medicine. EMDR is also associated with war veterans and survivors of severe trauma. But the research and my experience in clinical practice show that it's effective for a much wider range of experiences. If you have memories that still carry significant emotional charge, memories that affect how you see yourself, how you relate to others, and how you move through the world, EMDR may be worth exploring for you. You don't have to have been to war. You don't have to have a PTSD diagnosis. You can just have a memory that won't leave you alone. Here in South Florida, I use EMDR with a variety of clients carrying trauma, childhood abuse, and community violence. Experiences that often go unnamed, but do not go unfelt. EMDR works across all of those. If there's a memory that still hurts, that still triggers you, that still affects your life, EMDR may be the thing that finally helps it shift. Our EMDR trained therapists at Hawkins Counseling Center offer a free 15-minute consultation. The link is right below. Drop a comment. Have you ever tried EMDR? Or is this the first time that you're hearing about it? We put out new videos every week. I'm John Hawkins Jr., and I'll see you next week.